Hi everyone, this is class 4 of 5 in our prenatal series.
Today we're talking about labor and delivery.
I'm Brooke Graham. I'm a prenatal outreach coordinator for Kids First North.
And I'm Johanna Kaiser. I'm a family physician working in La Ronge.
So this presentation is just meant to give an overview of some important parts about having a baby. If you have a detailed question or a complicated situation or are worried about anything, we just ask that you would talk to your healthcare provider.
We want to talk about a few different things today. First, just reviewing some terms because there's a lot of sort of medical mumbo jumbo mixed in with the things you'll hear around labor and delivery. We'll talk a little bit about what happens during labor, what to expect, how to know you're in labor because it's not quite as straightforward as you might think, and then who's there to support you when you are in labor.
When we're talking about terms and a lot of the medical mumbo jumbo, there is a lot of obstetric language that's used in labor and delivery. And unless you work in labor and delivery, you're probably not hearing a lot of those words all the time. So we really just want to encourage you to ask questions and get familiar with some of those terms that can be a little bit confusing. It's okay if you have questions about, like, just ask, what is that specifically? A lot of people weren't paying attention in grade 8 health class when that was being reviewed. Sorry.
And we don't always do the best job as physicians of remembering which words are normal English and which words are crazy things that we learned in medical school. So if we're forgetting, please let us know.
So this is the simple story of birth. We often hear a lot of stories that can be quite frightening around childbirth, labor and delivery, and we need to remember that it is actually not always a scary event. So what we want to do is talk about the simple story, about a typical labor and delivery without any complications. We do live in a remarkable time where we can do a lot to deal with complications, but we just want to give you an idea of what childbirth might look like from the beginning to the end when it's a normal or the simple story.
We want to remember that birth isn't an illness. Even though lots of births happen in the hospital, it's a normal, healthy process for a lot of people. And so we just want to make sure that that story gets told as well.
So as you listen to this story, I just want you to be thinking about, is there anything that's different about this story compared to other childbirth stories that you've heard? What parts of this story do you like that actually made you feel like, oh, I could do that, that's interesting? Is there anything that you don't like?
Is there a part of the story that really stands out to you or speaks to you? And do you think this is a believable story?
So when you're done listening to this story, if you have any questions or thoughts, write them down. And just the questions that we asked at the beginning, try to listen to it first, then maybe listen to it again, and then write some thoughts down. Labor is often divided into 3 stages. A lot of that has to do with how your care providers approach and manage each stage of labor rather than how you might experience it. However, I think it's important that you know the 3 stages of labor because they are all very different and have different characteristics.
The part of labor that we refer to as stage 1, or the first stage, is when your contractions start and slowly, gradually thin out your cervix and also open it up so that the baby can pass through. There's kind of 2 little subparts of the first stage we call latent or kind of pre-labor and active labor. And so that's the call that people are trying to make often. Are you in labor or are you in that early latent pre-labor stage? But stage 1 is when your cervix changes, it thins out, it expands. And then once it's fully dilated, it's all the way open at about 10 centimeters. That's when we say stage 2 starts. And stage 2 is when the baby moves down through the birth canal, getting closer and closer to being born. And it ends with the actual birth of the baby. And then stage 3, which most people would think that maybe labor ends at the birth of the baby, but there's a little bit more after that. So between the birth of the baby and the birth of the placenta or the afterbirth, that's what we call stage 3. And so we're still monitoring We're still monitoring people really closely during that stage. We're still really working hard to make sure that everything is going well. And it's not an official stage really, but some people will talk about stage 4, and that's after the birth of the placenta, after the afterbirth comes out, just paying really close attention to that new mom, that new baby, in that really, really early stage of the baby's life.
So what happens during labor? We have a model right here of a uterus. This is a full-term uterus with a baby. So the uterus is actually a muscle inside your abdomen. And this is what, when you're in labor, this is what is contracting to move the baby down. So we just want to talk a little bit here about cervical effacement and dilation, which are fancy medical words.
Mm-hmm. So just to orient you, the cervix in between the uterus and the vagina, and the kind of exit point for the uterus if everything goes according to plan. So when you're not in labor, when your cervix hasn't changed at all, most people's are around that kind of 4 centimeter mark. They're nice and long. And then as we go through the effacement process, which is our fancy medical word for thinning out, this cervix kind of comes down, it spreads out, it becomes much thinner. And then along the course of the effacement, or sometimes afterwards, that's when you start to see that dilation. And that doesn't happen at the same speed for everyone. It doesn't even always happen completely within the bounds of what we call labor. Sometimes it starts to change in the days or weeks before labor. But when people talk about effacement and dilation, that's what they're talking about. The thinning of the cervix and then it opening up.
When you're at your doctor's appointment, they often say, like, right now your cervix is feeling quite hard, or they can say your cervix feels very soft. And if you want to know what that means, it means a hard cervix often feels like the tip of your nose, if you touch the tip of your nose. And a soft cervix feels like your lips. So if you touch your lips, that's what they're talking about when they're saying your cervix is soft or your cervix is hard. A soft cervix is ready to change. So what are contractions? So again, contractions are the tightening and easing of and relaxing of the uterine muscle. That's going to help bring your baby down through labor. This happens at intervals before and during childbirth.
And this is the pressure that pushes that baby down and helps that cervix open. So they might be something that people aren't super excited about, but they're a key part of labor.
Yes. So what are contractions like? Well, contractions usually come in intervals. A lot of women describe them sometimes as similar to menstrual cramps, just with the volume kind of turned up, if that makes sense. They often say it comes in waves, so one after the other, beginning kind of rising to a peak and then easing off. There might be like a mild sort of crampiness all the way through their hips and back. What else would you say?
Sometimes people feel the contractions spreading down into their legs. They feel them more in the back, they feel them more in the front. All of that is normal. Contractions are a little bit different for everybody.
Yeah.
So with everybody's contractions being different, even within the same labor, they can change a little bit. And so some people will start labor even when they're in early labor and really feel them and be really uncomfortable. And some people will go full into active labor and not really know until things are getting a little bit farther along. They'll just feel a little uncomfortable. And so how far that kind of menstrual cramp volume is turned up depends on the woman, and it depends on how far along people's labors are. So it will change as things go along.
So because it can be a bit subjective or a bit uncertain with labor, we just kind of want to have a good idea of how to know when you are in labor, right? And so there is a way to know that, and that is your contractions become more powerful and more frequent, and they don't stop if you change position. Okay, so that means basically if you're kind of wondering like, oh, this feels kind of strange, and then you go and lay down and everything subsides and you don't feel that same discomfort or sensation anymore, that's likely not labor.
The way that we tell when people come into the hospital is obviously to check someone's cervix and just see how open it is. Sometimes we can't even make that call labor or not from just checking it once. Sometimes we have to check it a couple times after a couple hours. And so if you're not sure, if you think, oh, this might be labor, I don't know, it's never wrong to come and check in with us and just ask. And we can help you out. We can help figure it out for you.
Okay, so you might be wondering if you can have contractions and not be in labor. And the short answer is yes. And these are usually practice contractions known as Braxton Hicks. So there is a difference between Braxton Hicks contractions, which are those practice contractions, sort of like your muscles getting ready for this big race, and then true labor contractions. So with Braxton Hicks contractions, they don't get stronger. They don't usually establish any sort of rhythm. They sometimes go away with walking or come on with walking. And they feel the strongest in the front, but most importantly, they're not really changing your cervix. So we've just talked about how we can have contractions and what those Braxton Hicks feels like. We just want to discuss the difference between Braxton Hicks contractions versus true contractions.
Contractions that are actually leading to your cervix changing, actually part of labor, feel a little bit different. So they progress, they get stronger, there's kind of that change in the contractions. They become more rhythmic and regular. So you might say, oh, they're every 6 minutes, they're every 5, they're every 4. And they will tend to get kind of closer and closer together. They'll sometimes get worse with moving around, sometimes not. It's hard to kind of base it too much on that. And you might not just feel them in the front. You might feel them really low. You might feel them in the back. So they're a little bit wider area that you're going to feel that squeezing and that pressure.
Mm-hmm. So, but those ones are becoming more powerful and more frequent.
Yeah. You notice that change, and that's a sign that you should be making contact with the healthcare provider that's going to be helping you with that birth. So one of the things that a lot of people might worry about or might wonder is happening as you're starting to have some Braxton Hicks contractions is, am I going into early labor? Am I going into labor either too far before my due date, far enough that it's maybe dangerous for the baby? Or am I going into labor, maybe it's not too far before my due date, maybe it's not before 37 weeks, but you're not in the community that you were planning on delivering your baby. And so both of those are situations that we want to make sure if you're in, you get help right away. And so some of the things that you would look for in your body, some of the things that you would be paying attention to are the same things that we talked about when you're going into labor. So are you having contractions that are progressing, that are getting closer together, that are covering a wider area? Does this not just feel like those regular Braxton Hicks contractions? The other thing that you might notice is if you get a big gush of fluid, like your water breaking, or if you're having bleeding. All of those are reasons that you want to get help right away. So if you're going into labor before it's your time, if you're going into labor when you're not in the right place, or if you're having bleeding or that gush of fluid, then it's time to go see your healthcare provider right away. So we talked a little bit about when you should go to the hospital or to go contact the healthcare provider that's going to do the delivery for you. If things are maybe not quite happening as planned, if they're early, if there's bleeding, that kind of thing. But we should also talk about, when do you go make that contact with the hospital, with your midwife or whoever, if things aren't going according to plan, because it's okay to be in labor at home for a little while, and a lot of women are more comfortable at home. We know that the early stages of labor are safer to do at home if everything's normal, if everything's going really well. And so that's another important decision point is, okay, is this time to go to the hospital or not?
So often what we say is if you're having contractions every 4 to 5 minutes, that are happening quite consistently for about an hour or more.
Yeah, about an hour is reasonable. But you also know your body, and if things are really picking up, if they're getting really intense, If you feel like you can't cope, or if you feel like things are moving fast in that hour, then it's time to go sooner. If you've had a really fast labor before, by all means, go when you think it's time. You know your body, and if it's not going to take very long, then you go to where you get the help you need. So,
and just to know that sometimes it does occur where you go to the hospital and it is too early, and so often that healthcare team might just say, you know what, you might just be better at home. And so you can discuss that with your healthcare provider if you do go to the hospital and it is too early. You should never be afraid of going, but just to know that that is a possibility, that they might send you back home to continue laboring and then come back once things have progressed a bit more.
Yeah, and there's no shame in showing up too early.
Yeah.
I know many healthcare providers, I know many doctors who do obstetrics that have shown up both too early and too late.
Yeah.
So it's okay to just go when you're worried, and if you think, maybe I should go, it's okay.
So what we'd really like you to think about is your birth plan. And I know that that's a bit of a loaded term for some people, in that we think it means that it's going to be, a lot of people thinking it's going to go like this, A, B, C, and that is not what we're trying to encourage. What we'd like you to do, though, is to consider some things beforehand, especially if you need to leave your community to have your baby, which is the case for a lot of people in Saskatchewan.
So some of the things to think about beforehand, first of all, is who do you want there with you? We know that women who are well supported in labor, who have one of the people that they really care about and trust there helping them, they have faster labors, they feel less pain, they're less likely to have C-sections. So that person is really important. Think about who you want that to be, and see if you can get that person there with you. NIHB now covers a support person to come travel with you if you have to travel to have your baby, and so make sure you take advantage of that if that applies to you. The other things to start thinking about are what's important to you for your birth. So is it really important for you to have no pain medicines? Is it really important for you to be mentally present? Like if you don't want to feel so much pain that you're kind of thinking of other things, like if you want to feel calm, all those sorts of things, what is really important to you? And then from then on, you can kind of think about what your options are. So what do I want to consider for pain? What are the non-medical things that I want to consider for pain too? Can my support person help me with that? Can my support person learn pressure points and things like that? And a good birth support worker can help kind of teach you about those things. And so kind of making a plan for, if things get worse, this is what I'm going to do. The other thing that I think is really helpful to do is to think about, how am I going to feel if things don't go according to my plan? What am I going to do if it looks like I might need a C-section? How am I going to feel about that? And to kind of think about that ahead of time and just mentally prepare for things. Most of the time, things go great. Like we said, this is a normal, healthy process for most people. But there are things that we sometimes need to do to help the baby be as healthy as possible. And if the plan changes and you have to have those sorts of things, it's good to have thought about them ahead of time.
Mm-hmm. So a plan is basically to help you to understand what your options are, and to think through some of the things you might not have considered up until that point. So even when you're leaving the community, how to get to the hospital that you're going to deliver in, where to park, what the entrance is, things like that, to familiarize yourself. So we do have a birth plan that you can download. It's on the NHCP website. It'll be located under resources. So you can use that as a guide. You can also take it to your care provider to have them help you if you aren't sure about some of the answers to some of the questions that are on there. The long and short is, if in doubt, check it out. That's kind of our rule of thumb. And just because it is a very complicated time. For some people, it's very straightforward. And for other people, there's a lot of anxiety and concerns. And so if there is something that is, that you're worried about, you can absolutely go and get it checked out. If you're feeling like not going to your healthcare provider every time, we do have a great service in Saskatchewan where you can dial 811 and talk to a care provider or someone who's trained who will help you navigate your experience.
So the next thing we want to talk about is something that I think Brooke is really well equipped to talk about, and that's managing pain at home, different ways to do that.
In a lot of media that we take in, if you haven't seen a lot of babies being born, and the only time you've watched a baby be born is on a TV show or a movie, then you've probably only seen women giving birth in one position, which is laying down or on their back, which is not the case in many hospitals around the province and around the world. Women give birth in a variety of different positions, and so it's important to get familiar with some of those positions and even try practicing some of them, because they can really decrease a lot of pain and discomfort. We naturally move to decrease pain and discomfort. If you think of standing in line at the grocery store, you see people kind of shifting back and forth. So try a variety of positions. Some of them might look a little odd to you at first, but women often are drawn to being in different positions during their labor depending on the type of labor that they're having. Some women might feel most comfortable laying on their side. Some people might feel most comfortable on all fours. Just get familiar with a lot of the positions that you can give birth in or labor in.
In a normal, healthy labor, it's really helpful to move around. It can be a really beneficial kind of way of helping things along and a way of feeling better.
So some of those positions can be standing, sort of a forward leaning. You could sit on like an exercise ball or something where you can sort of gently sway side to side. So we encourage you to try some different positions, because gravity is often a helpful force in labor, just to help keep things going. So when we're talking about movement during labor, so there's birth positions that you would actually give birth in, and then there's movement during labor. And when we're moving during labor, it's actually going to hopefully help the baby navigate its way through the bones, because if you didn't have any bones, it would be a lot easier to have a baby. Mm-hmm. So we want to be thinking about our bones a little bit, and that pelvic opening, and how we're having the baby and the position that we're in when we have the baby. So this is the pelvic opening. This is the pelvic bone. This is pretty tricky for the baby to work its way around. And so as a woman moves kind of sways her hips back and forth, also this little tiny tailbone here, right, can kind of, we're talking about a very small, limited amount of space. And so when it's compressed at the back, it can be very uncomfortable. So sometimes being in an upright, sort of forward, open position, that can create a little bit more room and then a little bit more comfort for mom. I'm not talking about comfort like a bubble bath. I just mean that it can just help her to feel a little bit less discomfort. I'll say that instead. So just trying to move so that the baby can try to navigate that space, because it is a little bit tricky. So we don't want to compress the bones too much. Some of the ways that we can move are actually pretty simple, and these can really help to decrease pain. And that is just slow dancing. You can do that alone or with a partner. Belly dancing, you can go as far with that as you want, but you can just even like simple circle eights, sort of gently with your hips, is a nice sort of opening movement. Even walking, really gentle, sort of easy lunges, swaying your hips, rocking back and forth if you're really tired, sitting on a ball. Those are just some examples of movement. So a lot of labor also it's a lot in your head, and where you put your thoughts and what you do with your mind. So when we talk about focus, that means focusing on something in a sort of a rhythmic, repetitive sort of way. That could be your breath. It can be mental imagery, something like waves. A lot of women, because waves, we can imagine what waves look like. They have a beginning, a peak, and an end. A lot of women really like that imagery because they can think about it as it correlates and partners with their contractions. So they can think, okay, I'm rising, now we're at the peak. Ooh, it's tough, and then they bring it back down. until there's a time of rest in between. So that's a pretty powerful, that can be powerful mental imagery. Another thing is vocalization. So women who use their voice. So that can be whatever you want. It can be saying something over and over. It could be just sort of a moaning sound. There's a lot of different things you can do to use your voice during labor. Another thing, this would be in between contractions, but you can try progressive relaxation. So that's to try to rejuvenate and rest in between contractions, where you would try to rest from the top of your head and then work your way down your shoulders, your arms, your muscles in your upper torso and abdomen, down through your legs, all the way to the tips of your toes. So if you can do this and practice this even during your pregnancy, it's a good thing to use to decrease stress and to even decrease discomfort during your labor. Another thing is just having music or using something like counting. A lot of these things, they have no side effects whatsoever, and they can actually really help decrease pain during labor. So some other things that you can do during your labor are using spot techniques. So some of that includes like a pressure massage. So not necessarily a massage that would go all over your back, though that's up to the individual, but just sort of like a one spot with lots of pressure, depending on how much pressure you like. It can be very distracting and comforting during a contraction.
And I think that's a good one to practice beforehand, especially if you know who your support person during labor is going to be.
Yeah.
Because it's maybe not the most intuitive thing to kind of figure out what that spot is that feels good. So practicing that can be really helpful.
Yeah. Other things that you can try are ice packs. Sometimes there's heat packs, things that can bring you comfort. Also, actually just going pee frequently through your labor, emptying your bladder. Your care provider will probably ask you to do that sometimes because it's something you might forget to do. But frequently hydrating, staying hydrated is really important, but also making sure that you do empty your bladder quite frequently. It seems kind of strange to say that, but it can be something that people forget when they are in labor.
And a full bladder can actually get in the way of that baby's head coming down a little bit. So it is something that as a care provider we will remind you and make sure that it happens.
Yeah. So having a shower, a lot of people are really drawn to water during their labor, and it can be a great comfort. Just like when you're not feeling well, normally in life, you sometimes just want to have a hot or a nice warm shower or a bath. You can also do that to help yourself during labor. Another thing is really just freshening up your breath. I know that sounds a bit strange, but sometimes a refreshing drink like a water with lemon in it or some minty gum or even brushing your teeth can be a little bit life-giving and rejuvenating. So try some of those things or pack them and have them ready. Some hospitals do have some rules about scent, so talk to your care provider about that. But if you're allowed to bring in some scented lotion or something that smells really good, that can also be a nice comfort as well. Just to have something, they do have essential oils and things, I just mean for the scent to have in a Kleenex. Because in a clinical setting, sometimes hospital smells aren't very nice. So having just a Kleenex with a little drop of peppermint or something can be comforting.
So we've talked a little bit about some of the non-medical ways that you can try to manage pain at home and when you're in the hospital as well. But part of a hospital birth is a little bit of extra help in that regard if you feel like you want it. And you don't have to know ahead of time, although it's nice to kind of think about that. Mm-hmm. But there are a variety of options kind of depending on where you are. So there are medications that we can give through an IV or in a muscle. They're all kind of in that morphine family of drugs. And what that does is help with the pain that you're experiencing during labor. We're pretty careful about timing it so that They should be out of your system right kind of as the baby's being born so that they're not affected by it. But if they do end up having a little bit of the medication in their system, that's something that we can pretty easily support them through. So it's not something to stress about too much. If that doesn't really sound like a good option for you, or you're not keen to go that way, we have other options as well. So we can do nerve blocks, where we just inject some anesthetic, the same kind of stuff that you'd get if you went to the dentist, into specific locations to try and kind of ease some of the pain and numb some of the pain of labor. We can use something called nitrous oxide, which is like a laughing gas that we give you kind of through a mask, and you just control yourself. You figure out when you're having more pain, usually during contractions, you can breathe it in, and then when you're not having contractions, you can just breathe regular old air. And then there's also epidurals in some centers, and so that's not in every place that you'll be able to deliver across the north or across Saskatchewan, but in some. And that's another great option if you want that as well. So the epidural works by putting that same medication that we use at the dentist to numb nerves into the bottom of your back, along with a little bit of the medication that is in that kind of morphine family of drugs, so a little bit of a combo there, and that can take away a lot of the discomfort during labor as well.
So epidurals, they don't actually impact your mind so much. It's more just your body.
When I talked before about thinking about what's important to you during labor, whether it's having as little pain as possible, or whether it's about being kind of mentally present, or whatever it is that you really want to prioritize during labor, that kind of comes into play a little bit when you're thinking about medication. So an epidural won't affect how you think, how you act. A nerve block where they inject a little bit of that numbing medication also won't affect that. But sometimes the pain medications, laughing gas, that kind of thing can cause a little bit of just a change in the way that you are alert. Just a little bit, but it's something to be thinking about as well.
So a lot of those medications, though, they are through intravenous, meaning you'll be on an IV?
Yeah, they can be given intravenous, that morphine family of drugs, or early in labor. We can actually give them into a muscle, so you don't have to have an intravenous. If you have an epidural, you will need to have an intravenous, just kind of for safety protocols and things like that. So whatever you end up wanting, whatever you end up planning for in terms of managing the discomfort, the pain during labor, I think it's a good idea to understand that all of these things, the medicines, the movement, the pressure techniques, all these sorts of things are a team. They work together, and you don't have to only have one or the other. And one of the really important jobs for the person that hopefully you can have with you, supporting you during labor, is to remind you of those options and to help you navigate them. So if you have your support person who's really knowledgeable about those sorts of things, whether it's a friend, a parent, a family member, a partner, a doula, whoever it is, one of those things they can do is to help kind of remind you of your options and ask you if you want them, to kind of bring you out of your discomfort and remind you about those next steps. We're into the heavy medical mumbo jumbo section of the presentation. Just kind of talking about some of these things that are there to support you when things aren't quite going as planned. I don't think they're things to be afraid of necessarily. I think they're just things to learn about ahead of time so that you're not surprised by the words, so you're not surprised by the ideas. So one of the things lots of people have heard about is a C-section or a cesarean section. And that's used a couple of different times. Sometimes we plan to do them in situations where we know maybe labor is not the safest option, or not an option that's going to work well for a woman. But there's also times that people end up getting C-sections in labor when things aren't going as planned, often for the safety of the baby, occasionally for the safety of the mom. And so the way that we do those is we use a really strong medication to either numb you from the waist down, or sometimes a medication to make you unconscious, so that you're not feeling any pain. And then a surgeon will cut through the layers of skin and muscle and things like that right at the very, very, very bottom of your belly into the uterus, and then deliver the baby out. They close everything up and they try and hide the scar generally as low as they can so you don't see it if you're wearing a bathing suit or things like that. So they try and do a really nice job of all of that. And that's a service that's available in some centers, but not every center that does birth. And so that's part of kind of planning that birth process is, do you want to be somewhere where you have a C-section capability, or do you not, are you not as worried about having that access really close by? And even if you do deliver in some place or plan to deliver in some place that doesn't have C-section capabilities, if things aren't going well, we can always send you somewhere that does. So plans can change, and don't worry too much about that. We've talked a little bit about epidural. That's kind of the next on our list to talk about. So maybe we'll kind of just mention that again briefly. A medication that goes into your spinal column to theoretically numb you from the waist down. Some of them are more successful than others, and some of them are what we call denser than others. Some people can walk when they have their epidurals, and some people find their legs are a little weak and can't. And so everybody's experience of an epidural is a little bit different as well, so that's something to remember. There's a couple other things on our list of medical terms, a couple other helper tools. So we have forceps on there, which is a set of helper tools that we can kind of slip into the uterus. There's a little kind of spoon on each side that carefully cradles the baby's head, and then while a woman pushes, we can kind of support that push and give a little extra power to help that baby get out. If the baby needs to get out sooner, or if just things aren't really going well with the labor and there's signs that they really need extra help. One of the other tools that we use besides the forceps, if we're trying to help a baby come out and give a mom a little bit of extra power to deliver that baby, is something called a vacuum, which sounds really scary, but is actually this tiny little thing. There's lots of different kinds, but this is kind of a modern one. And so the way it works, if I can get this thing out, there we go, is this goes on the baby's head and it kind of just sticks on. You want to be a baby for me? Mm-hmm. Thank you. There we go. And we just squeeze this a little bit to get a little bit of pressure in here. We have a gauge to make sure that it's in a safe range. I won't actually do it on your hand. And then once that's kind of attached gently, as a mom pushes, we just kind of pull as well, really gently, and help give a little extra strength. So that's another tool that we can use if someone's just needing a little bit of extra help in labor. Sometimes, but very rarely, people will need something called an episiotomy, which is a small cut that we actually make in the skin, just kind of off to the side, the skin and the muscle around the vagina, just to sometimes give us more room to help the baby come out if they're needing a little bit of extra help. And very rarely, just if the baby seems kind of hung up on that skin and muscle and not coming out. But they're not very often used anymore. And then I guess the other term that we should talk about a little bit is induction. And so that is kind of backing up to the before labor process. If someone's just not going into labor when they need to, whether they're way past their due date, and we want to make sure that that baby is born while the placenta is still healthy and working, or if there's things that aren't going very well with their pregnancy and it seems like it would be safer for mom and baby for this baby to be born now rather than later, then we'll do an induction, and that's using medications or sometimes other ways of kind of getting someone into labor. And there's lots of different types of inductions depending on lots of different factors. So if you do end up having an induction, the care provider that you're working with will kind of go through those options and talk to you about what's the safest for your situation.
A lot of women, rightly so, are very afraid of tearing during childbirth. And so we just want to talk a little bit about that and some things that you can do during your labor that your care provider will do to try to minimize the risk of that happening. Even if it's just for comfort or something like that, you can sometimes use like a hot compress or counter pressure. There are some physicians that'll use even a little bit of extra salve. You can talk to your care provider about doing something like that.
There's a little bit of research in that area. There's nothing been shown to really 100%. We know this prevents tears, but there's lots of different things that we can try and work with you to try and keep that as minimal as possible. The average tear is about a 2nd degree, which means through a little bit of skin and a tiny bit of muscle as well. But there's some people who have no tears. There's some people who have worse tears than that. But usually it's kind of that that second degree. And we can repair that right in the delivery room just with some stitches that we freeze and put in. And generally the outcome of that is really good. People go back to really normal lives afterwards. So everybody has a different kind of technique of supporting women right as that baby is coming out. And some doctors will put a little kind of pressure against the perineum. So you might feel a hand there just to kind of slow the baby's head out and kind of ease it out, let everything stretch and move gently. So there's lots of different kind of things that you might feel and notice during that time. And if that's worries you, or if you want to kind of hear more about what your care provider does actually while the baby's coming out, that's an okay thing to ask as well. That's a good conversation to have ahead of time.
And there's a lot of like different hormones and endorphins being pumped through your body to also help your vagina stretch. So things aren't quite the same going into labor as they are leaving labor. And a lot of that has to do with the process, like the hormonal process or chemical process, I guess, that's going on inside your body, which is actually going to help facilitate childbirth.
So there's lots of different hormones that your body produces to change the way that the connective tissue, the tissue that holds your body together, operates. And so a lot of those hormones are active in pregnancy and labor. And so something that might seem a little bit impossible when you think about it actually works over and over again. That's how we're all here. So
yeah. Once your baby is born, and once the placenta is delivered, the goal of most care providers, if everything is okay, is to get that baby onto your chest as soon as possible. So holding your baby skin to skin is something that is really encouraged. Your baby is not going to look like babies that are often on TV.
Yeah, so when your baby first comes out, you're right, it won't necessarily look like those TV babies. They're usually cleaned up and maybe 6 months old.
Yes.
Babies, when they first come out, can be a little bit pinkish, purplish. They might be a little bit blue at first when they just really initially come out, and their hands and feet sometimes stay blue for a few hours afterwards, and all that can be totally normal. It doesn't mean that there's anything wrong. When that baby comes out, your care providers will be checking it really carefully just to make sure that everything looks right and that they're making that transition from the inside of you to the outside world successfully. But most of that, usually all of that, when everything's going as planned, can happen with that baby on your chest. And we know that that baby does better in that situation. When we see babies go skin to skin, we find that women have better success breastfeeding. We find that the babies are able to regulate their temperature better, regulate their blood sugar better. There's all sorts of really great benefits for baby and for mom to kind of have that baby there. If for some reason that's not going to work kind of for mom's factors, that baby can also go skin to skin with somebody else, with a partner, with a family member, a friend. And so that can be something to prepare for and even dress for. So if you have a support person, they maybe wear a button-up shirt so that if need be, that baby can go right here. But that skin to skin is a really important thing. And so if you're comfortable with that, I would highly suggest it.
This is something we're seeing more with partners as well, that they can enjoy that skin to skin. And so even right there in the labor and delivery room, they can have that time with baby as well. If mom needs to have some toast and juice or something like that, then the partner can hold baby, and it's a very nice bonding experience.
Even with a C-section, if it's just not working for baby to come on mom's chest for whatever reason in the operating room, then that baby can still, right as soon as they're out, go to a partner or somebody else for that skin-to-skin time. So there's lots of research around feeding babies and trying to kind of optimize that feeding relationship. We like to encourage moms to try and breastfeed as soon as they're able, preferably within that first hour after the baby is born. There's a variety of reasons that sometimes that doesn't happen for women, and we want to support women as much as possible to breastfeed if they're willing to do that, and if they're at all interested in doing it. We like to kind of promote that as that first strong option. But in general, we want to support the feeding relationship. between a parent and a baby. And so getting that up and running as soon as possible is really important. If you're struggling with that, if you're not feeling supported, bring it up, ask about it. It's a big thing right now, and most of all, we just want you to feel supported with that new baby, regardless of what you're doing.
On the NHCP website, we have under resources a link that you can download for a PDF called My Birth Preferences, because there are a lot of areas with childbirth that you get to say what you'd prefer. So an example of that might be, if possible, I'd like my baby to be on my chest during any medical interventions or routine sort of medical procedures. There's a lot of routines that go on in hospitals, and not everybody has time to stop and ask you what all of your preferences are. So you can, a lot of them will try to accommodate your preferences if you know what they are ahead of time and can ask for some of them. So if, for instance, you would like to hold your baby during some medical procedures that are very common, then you can just say, I'd like to hold my baby. But you might not remember that at the time, so reading through this stuff, familiarizing yourself with what your preferences, or where you have options and a lot of room to negotiate. If you do that ahead of time, then the chance that when you go in to have your baby, that you know how to have that conversation, you've already thought about things ahead of time, you can talk to your care providers so that they know. You don't have to remember it. You can just have it sort of in a sort of brief bullet point paragraph even of the things that are most important to you.
And that's a good thing to discuss with your support person as well, because they can be there to remind your care providers when you're tired. Labor's a lot of work, not going to lie, and you might be tired afterwards. And so it's good to have that support person that can remind everybody, oh, you had wanted to do things this way. Can we try that?
Yeah. So for women who don't want to have a medicated birth, who think ahead of time that they don't want to have medication, it's quite common in bigger centers to be offered medication. So if that's something you don't want, you can just write, I'd just wait until I ask for medication. And then everybody can just kind of wait till you ask for medication. It's something just very simple that can make a big difference. If the expectation is that you're going to have an epidural, you might have people coming in, when do you want your epidural? When do you want an epidural? And instead, if you don't want to have that, then you can just simply write it down and say, I'm not sure what my thoughts are about medication, so please just wait until I ask, and your care team will likely do so.
I think it's important to clarify too that there's a few different types of medication that we use in labor. There's pain medicines, which I think is kind of what that discussion is around. There's also some other ones that are there like specifically for safety, that are some of the ones that have decreased maternal and child mortality and morbidity kind of throughout the years and years and years that we've been studying obstetrics. And so I think it's important to be clear about those sorts of things, whether you're thinking about pain medications that you don't want, or whether you're thinking about other medications, for example, to stop or to prevent postpartum bleeding or things like that, that you're turning down, because those are kind of two different areas, and it's important to consider all of those things as well, and what you want to do in terms of safety and things like that.
So just some summary points from this presentation is labor can take a long time for some women and be very short for others. Just go with what you have before you and try to take the breaks in between contractions.
Remember the signs of labor starting. So your contractions are getting closer together, they're getting stronger, maybe they're hard to talk through, they're kind of in a broader area. Those are all signs that labor is really starting to kick into gear, and it's time to consider getting in touch with your healthcare providers.
So it's important to see your healthcare provider routinely throughout your pregnancy, and also to seek medical care if you think you are in preterm labor or if you have any concerns.
It's never wrong to come and ask us questions. It's never wrong that if you're worried, you can go and get help. It's okay to be assessed, be told everything's fine and go home. There's no shame in that.
So with most labors, babies usually move down head first, and the contractions and pressure from the baby's head are what help to open the cervix.
You have lots of different options to help deal with the discomfort during labor, whether they're medications, whether they're movement, whether they're the support of a really good partner, friend, family member, doula, whoever it is that is there to kind of help you through. And don't underestimate the importance of that support person. We know in the research that it's really, really helpful, and just in general, when you think about it, you want someone there for that big time in your life.
So it might be kind of difficult to remember a lot of your pain relief options that you have during childbirth. So try to familiarize yourself with them ahead of time, write them down, and also talk to that support person so that they're aware and can remind you, or can also introduce or bring them up or provide them during your labor.
Wherever you deliver, you have the right to be treated with dignity and treated with respect. And different people have had different experiences at different centers. I know that. I know we need to work to be better. And it shouldn't be all on the women and families that are going through that birth process. But one of the ways that you can help is to think about things ahead of time. What's important to you in labor? If you want to, write it down. If you don't want to write it down, at least talk to your support person. And don't be afraid to bring it up. Even if it feels scary, please bring it up. Please let us know. Sometimes the plans that people have, the preferences that they have change in terms of safety and things like that. But no matter what changes in the birth process, that right to dignity and respect does not change. And so we will do our best to hold that up, and please do your best to hold us to that as well.
Mm-hmm. You do not check your right to your body when you go into a care setting, and so that is something that should always be respected. Anyone who touches you or does anything like that needs to ask for consent first, and that doesn't need to be told to them. They know that as professionals. If they need to be reminded, having a partner there who can remind them is a good idea.
We're working towards a really high standard of care for labor and delivery in Saskatchewan, but if we're not living up to what you needed, if things don't work out the way that you think they should have, and you have an idea for improvement, every birth facility in the province has a quality of care department, and they're your kind of go-to for help in that area.
So we've covered a lot of points that have to do with labor and delivery, and we've also left out a lot too. So every birth has some surprises around the corner, and we hope that you will feel empowered and informed when you go into your labor experience, and that some of this information stays with you.
Good luck on creating your own birth story.
Dancy, hello. My name is Flora Roberts. I'm from Kignac Friendship Center. I work with a prenatal nutrition program there as a coordinator. We are thankful and grateful that you're here with us, sitting with us today. We hope that this presentation of labor and delivery has helped you so that you can be prepared, cope with the challenge that's coming your way. I guess it's not really I guess it is a challenge, but it's mostly an adventure. You're bringing life into this world. Learn to breathe. Think positive. If you can, meditate. Take a deep breath. And slowly let your breath out. Calm yourself. You'll be good. You will. At the time of your baby's arrival, we hope that our wishes will reach you, your family, and especially that little one that's arrived into our world. Welcome, little one, we will say. Welcome to our world. At this time, I'd like to say a little prayer. Kisimantu upmachi huyu. Nimushumak igwa nukumak. Great Spirit, Creator, grandfathers and grandmothers. Ipagosidimuan kitapimidiak sagahiwin. We humbly ask you to give us love. Watch over the women who are our life givers. We pray for the safe arrival of all babies, as well as babies who have already arrived. Nanaskumun upmachi huil. Tatagisigaw kapimitiak. Thank you, Creator, every day for all that you've given us.